joining us today for our conversation on collaboration, complementing Flex, and working with networks. My name is Cami Norland, and I'm the Community Specialist here at the National Rural Health Resource Center, which is located in Duluth, Minnesota. It is a tropical 5 degrees here right now with a wind chill. So you folks in the southern states, we're jealous of the heat that you have, even if you are at 32 degrees. Thank you for joining us again. Today's conversation is we're going to hear an overview of the SHIP webinar series by Program Manager Tracy Morton, followed by key concepts of SHIP and the use of networks in SHIP from David Dietz. And then we're going to hear some examples from some state offices. We'll hear from John Barnes with the Michigan Center for Rural Health. We'll hear from Katie Jerkins with the Iowa Department of Health, and Carol Bischoff with the Montana Hospital Association. And those states are going to have approximately 10 minutes or so to describe the work that they have been doing that complements both SHIP and Flex.
Hi everyone, this is Tracy Morton, and like Cami said, I'm a program manager here at the National Rural Health Resource Center. And you can see on the slide right now, this is a picture of some of the center staff. We do have a few staff members that are missing. But I wanted to talk and introduce a little bit about why the National Rural Health Resource Center is assisting the Office of Rural Health Policy to provide these calls. As we know that some of you we have contact with in other programs that the center is involved with, and we wanted to clarify that a little bit. And I'll talk a little bit about what's to come with this webinar series. So as Cami mentioned, we work at the National Rural Health Resource Center, and we're a nonprofit that's located in Duluth, Minnesota, that's dedicated to improving rural health care throughout the country. We work on a variety of different programs here at the National Rural Health Resource Center, and the center's been in existence for over 25 years. So our connections to rural health care across the entire country are very deep-rooted. One of the programs that we interact with many of you in is the Technical Assistance and Services Center, or TASC, which is the Technical Assistance Center that supports the 45 states that participate in the Medicare Rural Hospital Flexibility Program, or FLEX. And we're going to be talking about that program today and how FLEX can work with the SHIP program, as well as working in collaboration through networks in the SHIP program. But we did want to clarify that this webinar series in its live format is directed to the state level the state level SHIP grantees in the hospitals. And so we do know that some of our Flex colleagues have been confused a little bit with not receiving the live invitations for participation in these live events. But we do want to make you all aware that the recordings will be shared with the Flex colleagues so that they're aware of what we're asking the SHIP colleagues to do with the SHIP program and vice versa. And that also that any of these recordings and materials that we produce can be shared with any of your rural hospital stakeholders that it might be applicable to, and certainly to the hospitals and other associations that you might be working with. So I just wanted to clarify a little bit that although some of the TASC staff is working and putting on these SHIP webinars and educational series, that they aren't necessarily only for Flex colleagues, but they're for many working in rural healthcare, and particularly for those working in SHIP. So we'll be doing 2 different webinar series, one focused on hosting 3 calls to the state level grantees. So the first call being today. Then there will be a call in mid-February, February 19th, about ICD-10 and what it means and what the impact will be, and addressing that not at the hospital level, not the nitty-gritty detail level of what a hospital employee might need to know about ICD-10, but what you all as state-level workers need to be aware of with ICD-10 and its upcoming impact. And then in May 21st, there will be a webinar about rural hospital participation in accountable care organizations and patient-centered medical homes. Both of those webinars will be an hour long, and I did want to remind you of the recording from last week about the technical guidance that David Dietz, Project Officer at the Federal Office of Rural Health Policy, went over about the funding opportunity announcement for SHIP. We won't be going into detail about those questions today on the call, But if you do have questions, David is available for contact. I think most of you received an email about that today. But just to know that today's call is really about the collaboration, working with Flex and working with networks. But those questions that you do have, we want to address, and you can either send them to staff here at the center, and we'll make sure that they get moved along, or you can contact David directly. Then there will be a webinar series that will be targeted to the hospitals themselves. And there will be 4 different webinars that will each have a complementing manual developed as well. The first call will be March 19th, and that will be about using HCAPS to drive patient and employee satisfaction. The second webinar will be April 30th, and that will provide an overview of lean and process improvement techniques. The May webinar will be on May 14th and will be about coding and cost reporting focused on ICD-10. And then in August, on August 6th, there will be the final webinar about shifting to a value-based healthcare system. So again, those calls will be for the hospital level webinars. We'll have 500 lines available. Registration for those will be required, and registration will happen through the National Rural Health Resource Center's webpage. More information to come on that as we get the registration site launched. And those all will be recorded, and those recordings and the accompanying manuals will be available for distribution to whomever you see fit. So that's just a little bit about what's to come with the educational series that the center is working on to support the Office of Rural Health Policy. And with that, I'd like to turn things over to David Dietz. Commander David Dietz is the project officer at the Federal Office of Rural Health Policy, working on the SHIP project, and he's just going to talk a little bit about some of the key concepts with SHIP.
Thank you very much, and I just want to thank everyone for joining in again this Thursday on back-to-back Thursdays when I know all of you are busy with the SHIP applications. I just wanted to reiterate that if you have any specific questions in regards to the funding opportunity itself, please contact me directly, as many as you have. I'm getting back to you as quickly as possible, so either shoot me an email or give me a phone call. But I'd like for this technical assistance call to focus on the specific states and hospitals that we're invited to present. So that being said, just to reiterate some of the key concepts of SHIP, as all of you know at this point, it's to improve accountability and integrity by focusing on a very specific subset of activities that can help support some of the greater FLEX objectives. Another point, obviously, what a lot of this call is going to discuss is how SHIP can complement FLEX. But then again, we have to be careful that CAUSE can't duplicate FLEX services with SHIP dollars, and the funds cannot commingle. We're also going to talk about the network aspect of SHIP, in that network hospitals have the opportunity to provide higher quality care by purchasing equipment at a reduced rate, as well as improving educational experiences by peer sharing, as well as lowering costs for training. Really quickly, the use of networks in SHIP, just to reiterate this from the FOA, networking hospitals 2 or more are encouraged but not mandated. FLEX networks can be used for SHIP and vice versa. Contracts and MOUs are not necessary for network formation. And I think throughout the next several years, both on the SHIP and FLEX side, we here at ORHP are going to start to pay closer attention to specific efficiencies that can be measured within these networks. So stay tuned on that as we will begin to discuss this internally.
Thank you very much, David. And again, if you have any direct questions regarding your FOA, please direct them towards David by calling him or emailing him. He's very receptive to those forms of communication. So thank you again. And we just wanted to highlight some of the benefits of collaboration between SHIP and FLEX, and some of those might be shared problem solving and providing a more comprehensive vantage point. For instance, if you're a hospital is receiving funds for implementing ICD-10, they can also receive the training. And just thinking creatively on shared problem solving, shared education and information, and building upon some of the existing work that's been happening, networking and peer support. There's many examples of HIT networks that have stemmed up within the last couple of years that provide some excellent examples of collaboration. Of course, discounts through shared volume, advocacy, new products and services. Two minds are greater than one, and shared access to technical expertise and education. If you're hosting a training or a webinar, invite the Flex folks as well. So with that, I'd like to hear some of the examples from the states on how have SHIP and Flex collaborated in your states. We'll hear about some of their success stories, perhaps hear from a hospital that's within their states. They may share some tools and resources that were helpful with this collaboration, and then actions that they suggest for other states to encourage collaboration between SHIP and Flex. And we'll begin by hearing from John Barnes with the Michigan Center for Rural Health. John? Star pound to unmute your line.
Thanks, Cammie. I needed that prompt.
No problem.
Ed, if you're on the phone, would you hit star pound too? All right, I'm not sure if Ed's going to be on the...
I'm on the line.
Oh, Harry. How are you, Ed?
Good, John.
I'm just going to give a brief overview, Ed, and then I'll turn it over to you because you and your group are the ones who do all the work. This worked out really easy for Michigan. We do have a quality network in place among, I think it's 36 critical access hospitals and 2 PPS hospitals. Ed Gamache, who's the CEO of Harbor Beach Community Hospital, is also president of the Michigan Quality Network for Critical Access Hospitals. And what we've been doing is, I think for about 6 or 7 years now, is we've had a combination of funding using Flex and SHIP to purchase a performance improvement tool. Once it was called Core Options, now it's called Quantros. And what we end up doing is the Flex side of the funding is the data collection and reporting to the hospitals and the quality network, and we use the SHIP side of the funding for submitting data to Blue Cross Blue Shield and Medicare. This has been real successful, and I think rather than hear me talk about it, the guy who makes it all happen is Ed. And Ed, if you wanted to chime in, go right ahead now.
Well, I think you made the two distinctions between the SHIP structure and the Flex, and the ongoing networking activity. The networking activity has been going on for over 10 years now. It started shortly after the Critical Access Hospital program was established in the state of Michigan, which I think is really good. We still have 100% participation, and we support, our primary goal is to support the quality members, quality leaders at each individual Critical Access Hospital and what they need to do, what they hope to accomplish. And through the funding, we've been able to add really some good support. When we first started this program 10 years ago, we had quality leaders that didn't have a computer on their desk, and now all of them have computers. They're all collecting information. They're all submitting the information. And when John talks about the submission of the data to Blue Cross, Blue Shield, and Medicare, Blue Cross and Medicare, that's really significant. Now with the HCAP support that have been added, we've seen an increasing level of participation by hospitals. But the networking activity is significant. There's a lot of sharing that goes on. We have best practice work that goes on. And while the hospital compare work and some of the other required measures are very, very important, the reality is that the networking activity has really allowed us to add a dimension of professionalism to our critical access leaders. They participate in a number of activities. A lot of them are active in regional STEMI projects now, and they get they gain understanding of how to do it from the networking activity. I think one of the important things for us is within the state, a number of quality organizations continuously reach out to us to have a representation from critical access hospitals, and because of networking, we've been able to do that. We're on our QIO in the state advisory board, that's MPRO. We sit on MHA Keystone, which is a large quality effort from the Michigan Health and Hospital Association. We sit on the Blue Cross Blue Shield. We actually, the critical access hospitals led the Blue Cross Blue Shield Pay for Performance program when they asked small rurals to participate, and CH has represented about 3/4 of those. And of course, we've gotten a lot of national exposure to the success that we've had with our networking and reporting. And then it also made it much easier for us when MD-QIP came up as a process. The group in total reviewed the material, decided to participate, and we were able to get 100% participation, and now we have a very good reporting process. So I think those are some of the highlights, and I don't want to steal too much more time. I'll be glad to answer any questions, though, if there's time for that.
Wow, that's impressive, Ed and John. Thank you for sharing. I'm glad to hear that you're really seeing some of those benefits of networking and some of the activities that you've used of HCAPS and STEMI. That's really wonderful. Does anybody have any questions for John and Ed while they're on the line? If so, star pound to unmute your line.
Thanks, Cammie. Thank you, Ed.
Thank you.
Yes.
All right, see ya.
All right, not hearing any questions at this time, we'll move on to Katie Durkins with the Iowa Department of Health.
Hi.
Great. Hi, Katie.
In Iowa, we have 86 SHIP hospitals, and 82 of those are critical access hospitals. We don't do like a statewide program or training per se. We actually leave it up to the hospitals on how the SHIP dollars will be spent, as long as it's in the means of the program. We do individual contracts with each hospital and administer the contracts and then watch to make sure that they are using the funds as they're supposed to make sure that they're using the SHIP funds with the FLEX program. Every August we do a survey through SurveyMonkey to receive feedback and see what hospitals really think, and then to get feedback on collaboration between the two SHIP and FLEX programs. In August of 2012, we did a survey, and we actually had a 74% return rate, which is getting much better than it has previous years. And David has a copy of the survey. If anyone would like one, feel free to send that out. But we do general questions of things like how many years has your hospital participated in SHIP, and then we have them rate how important SHIP funding has been in assisting with the different categories. We ask a question to rate your familiarity with the services provided by the FLEX program. We do this one just to get an idea if we need to do more education in our state on what FLEX is, or a lot of times with the hospital, the person working on the SHIP grant is not the same one working on the FLEX grant. So we just want to make sure that that's a high number there. We had 72% of the hospitals are familiar or very, very familiar with the FLEX program, so that was positive. Then we go on and we ask if our hospital participates in a network and if the SHIP and FLEX program funding work together to enhance programs or projects with your hospital. Like I said, in Iowa, we really leave it up to the hospital how they spend the funds. We monitor it to make sure it fits within the means, but it's up to the hospital. We found that 78% of the hospitals are coordinating funds between SHIP and FLEX with their hospital. And then we have a question, or a fill-in-the-blank couple of questions that, do you have any suggestions on how to improve collaboration activities between these programs? We got a couple of people say, more education on what the programs can do together and what they can't. So here in Iowa, we're looking at that and how we're going to educate the hospitals. And then I always ask if there's any recommendations for the SHIP program. And we found here in Iowa that the survey helps us a lot just to know what the hospitals need, and we leave it really up to the hospitals, and then we still get feedback. So that's where we're at.
Great. Thank you very much, Katie, for sharing. Is this an annual assessment or survey that you send out?
Yes, we do it the end of August, or the end of the SHIP year. So we do it in August. They send it out usually July, and then they complete it, and then we evaluate. And then for the next year in SHIP and FLEX, we can evaluate what we need to do differently.
Okay. And might a copy of the survey be available for others to see?
Yes. I think David has it, but I can email it to whoever I need to. And then we also give all the hospitals a map of where all the other participating SHIP hospitals are just to let them know. But those are both available, and I don't know what the best way to get those sent out would be.
Yes, Katie, this is Cammie Norland, and I will email you requesting that information. And if you could send that to me, then we will send it out to the rest of the folks
Okay.
on our SHIP reserve. Thank you very much.
Yes.
That'll be helpful.
So, Kate, I have a question for you. You talked a little bit about a question on the survey. I forget exactly what you said, but something about are you using SHIP and Flex funds together or something? What was that question that you asked?
Do the SHIP and Flex program funding work together to enhance programs or projects within your hospital?
And do they just answer a yes or no, or do they explain how they're doing that?
It's yes. They either answer yes sometimes, rarely no, and not sure. One year we got a lower rate on that, and so we did more individual. We sent out an email and asked for clarification, and then we had people just email us back, you know, are they or aren't they?
I hate to put you on the spot, but do you have an example of what a hospital has said when they've said yes? Because this is Catherine from Wisconsin, by the way, I can't see any of my hospitals really answering yes to that at this point. And I find that to be because, as Dave, I think, said, one person might be doing SHIP in a hospital and one might be doing a Flex project, and they really don't know what the other is doing or don't understand how they work together. That's really impressive to me. Do you have an example of how they work together?
That's something we're really working on in Iowa, is working with the two programs and getting them more, because like you said, you usually have one person that does one program and one that does another. So even with the survey, if you just bring it to their attention, do you work with the Flex program, it raises the awareness on their end. What is Flex? And they may look into it at their end. We also are doing a one-page like education thing of all our different programs, and then I'll send it to all the SHIP contacts, and it'll be sent to all the Flex contacts, just to give an update on what the two programs are, and we're trying to educate them from our end, because I know that communication isn't taking place at the hospital, so we're trying to create that. I don't know an example off the top of my head. The best thing I can think of is, I know that with Flex funds, you can't purchase equipment. So if they purchase equipment with the SHIP funds and then use the Flex funds for the education piece or the training part of it. Does that make sense?
It does. Do you?
And I can pull some more. I can go through my emails and pull examples and send those to you.
Well, it might just be, and we can talk more offline so I don't take up too much time. This just really grabbed my attention. Do you give some Flex funds to your hospitals, like little mini grants or something?
Yes.
Oh, okay. See, and we're extremely project-based and contract-based, so they'd be familiar with a project we're doing, but they may not even know it's Flex funding behind it, except for maybe like the introductory letter to the project.
Okay.
So, yeah, so that's where my confusion was. So now I understand.
Catherine, this is Sarah Roberts from Kansas.
Hi.
And I'm glad you asked that question because I had a similar question, because we do more contract program basis, so thank you.
Oh, yeah, you bet.
Are there any additional questions for Katie? If so, press *pound to unmute your line.
Hello.
Hello.
Hi. This is Carol Bischoff.
Hi, Carol.
Are you ready for me?
Yes. Hearing no other questions for Katie. Thank you, Katie, very much for your time, and thank you, Carol. We'll move on to hear from you. Thank you.
Okay. Sorry, I wasn't sure if I'm sorry. I hope I didn't interrupt anybody. So anyway, I'll carry on.
Thank you.
You know, unlike Michigan, or actually there are many parallels between Montana and Michigan in that we have also a very dynamic network in place under the Flex program. But the FLEX program is administered, is the official grantee is our Department of Health and is actually administered by the Montana Hospital Association, whereas the SHIP grant is administered through the State Office of Rural Health. So I think we're kind of here as an example of how even though we're in different organizations and even different cities, we have a fair amount of cooperation, and actually going forward now I think there'll be even more. And I think Cindra is on the call from the State Office of Rural Health. She actually conducts the work with the SHIP program. So Cindra, if you want to chime in on anything, feel free. So basically, I can give you some examples. We've also, like Michigan, worked very closely with our QIO on quality, and so when MBQIP came along, we were actually doing very well, but one of our stumbling blocks around the HCAHPS reporting, which is what we're working on now, was the purchase of services from a third-party certified vendor. And I know a number of, Cindra and I reviewed the, what these SHIP funds had been used for, and a good number of them went to purchasing that contract with the third-party vendor, which of course is necessary to report the HCAHPS data. So we're kind of well on our way there. Our MBQIP numbers are good. This year, given the more focused direction from SHIP, we actually had a meeting with our administrators last week or the week before, when Cindra came over with all of her paperwork and spent some time visiting with our administrators and shared with them the application and the requirement that the number one requirement to spend on MBQIP activities. So we were able, between the two of us, to identify the hospitals that needed a little boost, and we will be preparing a joint letter that we'll send to them and give them some suggestions for how they may use their SHIP funds and not conflict with what's happening within the FLEX program. And I've already heard from one hospital that they're all on board with this, and they had a couple inquiries of me, which I should probably pass along to Cindra. So it's a little bit different in that we're not even in the same company or same organization, but yet communicate. And I think that's kind of the key for us here in Montana. We're a very large state geographically, but our healthcare world is very small, so we tend to communicate quite a bit and keep our doors open. Cindra, did you have anything that you wanted to add to this from your perspective? Star pound, I guess. Maybe Cindra had to leave. So I'm sorry I don't have a specific example from a hospital. I do know that the SHIP funds are important, and I'm anticipating going forward that there will be an increased cooperation and collaboration between our two programs.
Carol?
Yes.
Star pound is just really challenging for me here, but I'm through now. So
figured it out, huh, Cindra?
This is Cindra Stahl. I'm at the Office of Rural Health in Montana, and I would second what Carol had to say. Just the fact that our two offices have worked very closely together really helps us to stay focused on the projects that we need to be focused on. And I can ask Carol for help for certain things, and she can certainly ask our office for help as far as who's doing what and which hospitals need to be spending their money on the MBQIP information and which ones can go on to the other uses for their SHIP funds. So our office and Carol's office, our long-standing relationships have really helped us to move projects forward, I think.
And I think to the point almost where the people in the facilities think we probably work together, because I know frequently get questions that are for Cindra, but that's okay. I just send them on their way.
I really like the idea of doing a survey, and maybe Carol, as we move forward, that might be something we can shamelessly steal from Iowa and put to use on our projects.
I agree, Cindra.
Great. Thank you very much. That's an excellent example of sharing data, and we will certainly try to get that Iowa survey out to you folks. I'd like to open up the forum a little bit for hearing about any other examples of folks using SHIP within networks. Is there any brave soul out there that's willing to share an example of how they're using networks within SHIP? Or within group purchasing?
Hi, this is Bob Pennell in Florida.
Oh, yes. Hello, Bob.
Hey, just wanted to let you know we've had a patient and medication safety network for the critical access hospitals through the FLEX program for about 10 years now. We subcontract with the QIO here in Florida, who subcontracts with the University of Florida College of Pharmacy to provide expert consultants who actually go out to each of our CAUs during the year and assess their progress in terms of deficiencies they need to correct and what would be the best recommendations to implement to improve med or patient safety. And laid on top of that, we started a FLEX financial collaborative with an organization called Hometown Health out of Georgia, which is a rural hospital association in Georgia who's moved into Florida. So they are working with our critical access hospitals to identify and implement financial measures that they can use to track their performance using iVantage. And laid on top of that is a SHIP collaborative through the SHIP grant for about 13 critical access hospitals and 5 PPS hospitals, which is focusing primarily on ICD-10, but is also helping the hospitals with patient satisfaction. And on top of that, we're providing grants, small grants to the SHIP hospitals to actually contract with a vendor to implement patient satisfaction surveys for their hospitals for the first year.
Wow. You are busy.
We try.
Yes. Thank you for sharing, Bob. And is this something that you've done in the past and you're looking to continue these activities on in the future?
Well, the SHIP collaborative is still in the first year. We're hoping to get the hospitals to buy in for the next year because it's actually going to take that long to get them trained and go through the entire process of implementing ICD-10. The FLEX Financial Collaborative will continue as well, and as will the Patient and Medication Safety Program.
Great. Great, thank you. Thank you for sharing, Bob. Are there other examples of collaborative efforts that states have done, either through value-based purchasing or shared access to technical expertise, shared education and information?
Tammy, this is Sarah Roberts.
Yes, hello, Sarah.
And here's an example of what we've done. I should put a disclaimer. We have to do it differently this year. Simply put, there has been significant changes in our contracting abilities at the state, and so we haven't gotten the flexibility to do this year. But in the past, and my predecessors have set this up, that our critical access hospitals could could put $1,000 of their money. I should caveat it, we have 83 critical access hospitals, so and any CHIP hospitals could put the $1,000, so it could be up to $96,000, but $1,000 per hospital into what we called a consortium pot of money. And then here at the state, we collaborated with various statewide partners to offer specific training or technical support or help continue our technology infrastructure. So in the past, for example, last year, we used some of the funds to working with the ICD, we have an ICD-10 statewide task force who wanted to hold a one-day workshop regionally across the state about the first steps in a readiness assessment and how to use some tools and resources. And so we helped support those 4 of them across the state that allowed it to be pretty much that the cost to the hospital was just to pay for the food, basically. So we were able to cover the speaker's cost. We've also used it in the past to help with our subscriptions to the Quality Health Indicators Project, the benchmarking system. And we've also used it for things related to quality and performance improvement training opportunities. Like I said, that worked well for several years. Unfortunately, our contracting processes have become very restrictive, and so we were not able to do that this year. Instead, each hospital is going to put money towards a specific area using that $1,000.
Okay, great. Thank you for sharing, Sarah. And it sounds like you're finding a nice workaround and meeting the new requirements. So I think what we're seeing here is, perhaps you folks have seen this slide before. This slide is one that we've used in the past, and it's a cute slide demonstrating how really the mouse can't find the cheese at the end until they all begin to think and work collaboratively, and they stand on each other's shoulders, and they're able to then find the cheese at the end. So as you folks are writing your SHIP grants, I hope that you're able to network with your Flex and other partners and find that cheese at the end of the maze. I know this is your minds are all wrapped up in the grant applications at this time. If you have any additional information that you would like from today's speakers with the states, I've left their contact information and our contact information as well. At this time, I'd like to open up for general questions regarding collaboration.
This is Patrick Lipford with the Tennessee Department of Health. I hope everybody is doing well. And I just have a quick question regarding what states do with their SHIP funds. The Tennessee Department of Health, State Office of Rural Health, has always taken the position that we wanted to get as much money out to the small hospitals as possible, and have never attempted to establish any type of network. It's their money. They can spend it on what they deem best within the guidelines of the program. And I'm just curious as how many other states do that, or how many actually have organized programs in which they develop networks for SHIP. Has there ever been any survey conducted along those lines to show how many SHIP programs are just funneling the money straight to the hospitals versus establishing networks?
Yeah, Patrick, that's a good question. This is David. I don't think there's been a national survey. I know that the states have answered that in regards to their applications, whether or not they're using some networks in the past. But I think myself being among the major culprit here, in central office really need to start collating that information starting this year. Because I think a lot of folks out there, and I know especially the grantees in my region, are doing a lot of networking activity on the Flex side. Some of it they're doing on the SHIP side to support the Flex education opportunities with the purchase of hard items, hardware, software, equipment, etc. But I don't, to answer your question, I don't think at this time I have something nationally that would spell out or describe how many states and what each state has been doing. But I will by the end of this year, I promise.
Okay, great. Thanks.
Are there any states that have an example I could share with Tennessee? Okay. Again, if there are additional questions or comments, you can hit *#. And not hearing any people chiming in.
This is Pat Carr in Alaska, and if you have a moment, I might share just a little bit of what our history has been.
Yes, wonderful. Thank you, Pat.
What we have done over the years, we previously had done quite a bit of work through our hospital network that was being coordinated by and staffed by our hospital association. And then we stopped doing that for a while. There was for a number of reasons. For a few years, we stopped doing it. And we were doing all the awards directly out to the hospitals. And now this past year we have recommitted with the Hospital Association and the hospitals in discussions and strategic planning to allow the hospitals to make a choice as to whether they wanted to pool their monies in the network, because we established a small hospital network. And so we gave them a choice. And this year we have most of our hospitals have chosen to pool their funds together and do it, work in a network for their SHIP funds. But there are 4 or 5 of the hospitals that receive their funds directly because they feel it's more appropriate for them to receive them that way and to focus on their own projects. And one of the efforts that is underway right now is a joint training for those that have pooled their funds to do ICD-10 training, online training. And so that's pretty exciting to get up and running. And then this training will also be available to to a broader range of hospitals at a cost.
Yeah,
so you might find that's rather a blend, and it's the cooperation between the Hospital Association and the Small Hospital Network and our State Flex program and our State SHIP program.
That's an excellent example. Thank you, Pat, for sharing that. I think that's the direction that a lot of states may be heading in and looking at trainings for ICD-10, this upcoming grant cycle.
So
with that, thank you all for your time, for listening to today's webinar, and we appreciate the work that you do. And we have our next upcoming SHIP TA webinar scheduled for Tuesday,